to hit a new record of US dollars 9.5 billion, providing a 4.8 month of import cover, the highest in 10 years. This resilience shields us from external shocks in the global economy and restores investor confidence. Ladies and gentlemen, interest rates are also trending downwards, reducing borrowing costs and freeing up fiscal space for growth-enhancing initiatives by business. Tax revenues have grown by 11.5% in the year to June 2024, reflecting the success of our tax-based expansion measures. The economy continues to grow steadily, recording a 5.6% growth rate in 2023, among the highest globally. We project 5% growth this year and 5.6% growth next year. Honorable members, our efforts to secure food security and stability are already bearing fruit. Since February, we have distributed subsidized fertilizer to 6.45 million registered farmers in 45 counties, enabling them to increase their yields. And this year, we have procured and through e-vouchers distributed 7 million bags of both planting and top dressing fertilizer to boost food production across the country. This intervention will see a projected increase in maize production, for example, to a record 74 million 90 kilogram bags. We have also concluded long-term agreements with 11 suppliers of assorted fertilizers so as to make this commodity available all year round. Fertilizer for the long rains season will be stocked in outlets nationwide, ensuring our farmers are ready to plant, grow, and produce. This forward momentum will not only increase our agricultural output, but also reduce our reliance on costly food imports, securing a more self-reliant and a more prosperous Kenya. This approach, rooted in my administration's policy to support production rather than subsidize consumption, has already made food more accessible, more affordable to many households. Today, Kenya boasts substantial national stocks. 47 million bags of 90 kilogram bags of maize are in our stores. 8.8 million bags of beans, 10.4 million bags of wheat, and 2.1 million bags of rice. Slowly but surely, we are building a food-secure Kenya, where families need not to worry or worry less about their next meal. In the sugar sector, we have achieved a historic milestone. All 17 sugar factories across Kenya are now operational, producing at impressive levels, while 4 new sugar factories are under construction. In July alone, domestic sugar production reached 84,000 metric tons, surpassing the national monthly consumption average of 40,000 metric tons. For the first time in recent history, Kenya is producing enough sugar to meet our local demand. This success is attributed to many factors: subsidized fertilizer for sugarcane farmers, an additional 500,000 acres that has been brought under production, and improved management of the sugar sector, which have revitalized production and brought the industry back to life. I just signed, as you know, the new sugar laws to provide further policy guidance as we seek to be a sugar exporting country shortly. In the coffee sector, we are on track to increase exports from 51,000 metric tons this year to 150,000 metric tons by 2027. The government has also raised disbursements from the Cherry Advance Fund from 2.7 billion to 6 billion Kenya shillings, complemented by an additional disbursement of 1.5 billion by the Commodities Fund. Average prices at the Nairobi Coffee Exchange have risen by 25%. And in the last financial year, the country produced and exported 48,000 metric tons, earning farmers Kenya shillings 25 billion. Additionally, 320,000 bags of fertilizer have been allocated specifically for the coffee sector, and we will be working with cooperatives to make sure this fertilizer is distributed at the nearest possible destination to the farmers. These interventions are expected to boost smallholder farmer earnings from Kenya shillings 300,000 to 500,000 per acre annually by the year 2027. The dairy sector remains a vital value chain with a quick turnaround impact on households in the economy. The government of Kenya has released and new members approved 3 billion shillings to modernize the new KCC, ensure farmers are paid on time, and maintain a high price of Kenya shillings 50 per litre. As a result, intake to KCC has increased from 100,000 litres a day to 220,000 litres a day by last month. Other strategic interventions include the extension of duty-free imports for feed manufacturing raw materials, subsidized artificial insemination services, and the reduction of sexed semen costs from 7,000 to 2,900 through the Kenya Animal Genetic Resource Center. These measures have led to a 14% increase in milk production from 4.6 billion litres in 2022 to 5.2 billion litres in 2023, with projections exceeding 6 billion litres this year. The value of exported dairy products has nearly doubled, rising from Kenya shillings 4.8 billion in 2022 to Kenya shillings 7.2 billion in 2023. These gains demonstrate how targeted policies can deliver tangible benefits to dairy farmers and drive growth in our economy. Honorable members, by 2022, the education sector was in a crisis with a lack of clarity in transition to the competence-based curriculum, a shortage of 110,000 teachers, and 23 out of 40 public universities were technically bankrupt and at risk of closure. Among those facing severe challenges were huge institutions such as my own alma mater, University of Nairobi, Kenyatta University, Moi University, Egerton University, Maseno University, Masinde Muliro University. To address this issue in our education sector, we have already hired, as you know, members, 56,000 teachers and are in the process of recruiting another 20,000 by January next year. We have also ensured the seamless transition of learners from primary to junior secondary and domiciled grades 7, 8, and 9 in primary school, optimizing the use of existing infrastructure, ensuring the safety of young learners, and protecting parents from the high costs associated with boarding schools far away. Recognizing the financial challenges faced by our universities and TVETs, we introduced a new student-centered higher education funding model. This model gives priority to the most vulnerable students, offering them up to 95% government support, while also pulling our universities back from the brink of collapse. The remaining challenges for a few universities, like Moi University, are related to internal administrative and governance issues, which I have given firm instructions that they should be addressed. To further enhance access to higher education, we launched the Open University of Kenya, and this House approved that exercise, paving the way for more students to achieve their academic goals. The institution's first cohort of students is scheduled to graduate next week on the 29th of November 2024. Honorable members, universal health coverage is a cornerstone of our transformation agenda and a matter that touches every Kenyan family. Despite health being a devolved function, we acknowledge the immense financial burden that comes with health. Counties have struggled with shortages of medicine, equipment, sometimes staff, hindering service delivery and leaving countless Kenyans with suboptimal access to health care. It would have been easy for me to step back and leave this responsibility to counties alone. But that would have been a disservice to Kenyans and a betrayal to our Constitution. Instead of engaging in debates about healthcare being devolved, I have chosen the hardest but necessary path of addressing this challenge head on. Health delivery is not just about fulfilling a constitutional mandate by whatever level of government. It is about ensuring that healthcare is not a privilege for the few who can afford and a pipe dream for the many who cannot. For years, NHIF was saddled with debts and inefficiencies, and healthcare was being severely and negatively impacted. For far too long, too many households have lived on the edge, just one illness away from financial catastrophe. Our healthcare system has historically neglected the poor and vulnerable, leaving them without any option, while private sector medical covers remained out of reach for the majority. This is precisely what we will correct through the provision of universal health coverage. This agenda is not just about a promise. It is about a bold commitment to deliver health through transformative financing reforms, making healthcare accessible and affordable, digitizing our healthcare services to enhance efficiency, eliminate fraud, and stop corruption, and to empower a skilled and motivated health workforce. To honor our commitment on the universal health coverage, I signed into law 4 groundbreaking legislation on the 19th of October, passed by this August House. The Social Health Insurance Act replaced the outdated National Hospital Insurance Fund and established the Social Health Authority, which oversees 3 essential funds. This modern framework ensures that every Kenyan, especially the most vulnerable, can access quality healthcare services when they need it most. The shift from the National Health Insurance Fund model to Taifa Care is fundamental and radical in both scale and character. NHIF, if I give you a bit of example, NHIF served a few salaried Kenyans and those who could afford to pay. But Taifa Care covers every Kenyan, regardless of employment or financial status. Secondly, despite serving a limited class of citizens, NHIF nevertheless accumulated billions of shillings of debt because of misalignment between contributions and the actual cost of healthcare. Taifa Care has undertaken an accurate costing of all healthcare-related goods and services in order to provide timely, effective, and efficient service to every Kenyan that is affordable. Additionally, the NHIF had a waiting period lasting between registration and eligibility for service. I think it was like about 3 months. Under Taifa Care, citizens are eligible for all services upon registration. I therefore urge every Kenyan to take the most important step in securing dependable health care for themselves and their families. Register. Register now or at the earliest possible opportunity. Honorable members, for the first time in our nation's history, free primary health care is increasingly becoming available at dispensaries, health centers, and hospitals. Ambulance and emergency services are also slowly but surely being made available at no fee. Under Taifa Care, we have introduced a comprehensive benefits package that brings specialized care, such as cardiothoracic surgery, within reach for many Kenyans without the burden of financial strain. Through the Digital Health Act, we are revolutionizing healthcare delivery. Every step of the process, from registration, eligibility checks, to claims, is now digitized. By eliminating unnecessary human interaction, we are tackling corruption, reducing inefficiencies, and ensuring that resources are used where they are needed most. As a result, the good news, SHA will pay all October claims in full by next week. And it will continue like that going into the future. To date, over 15 million Kenyans have enrolled in Taifa Care, and more than 60% of employers have successfully transitioned into its framework. The newly established Social Health Insurance Fund empowers citizens to contribute towards accessing a broad range of healthcare benefits. This represents a seismic change from the old reactive healthcare model to a forward-looking system that prioritizes prevention and preparedness. Once the transition from NHIF is complete and SHIP becomes fully operational, Kenya will have a healthcare system that guarantees dignity, peace of mind, and equitable access for every citizen for the first time in our 60 years of independence. Honorable members, we have launched an ambitious healthcare program, one that Kenya has always needed and deserved. Like any major transition, there are challenges that are far-reaching. Rent, as a component of the cost of living, is unsustainable. People are forced to choose between enduring long, punishing commutes to faraway homes or taking up less desirable spaces within reach. Supplying the number of units required to fill the affordable housing gap requires us to undertake construction throughout the country at the rate of 200,000 new housing units every year for 10 years. Many people have asked why they should be interested in affordable housing project in rural areas. If you look around, you will witness the signs of our urban future. Land sizes are becoming smaller as the population grows in rural agricultural areas. To protect agriculture and food security from the effects of uncontrolled land fragmentation, urbanization must be planned and must be controlled. And the affordable housing program is therefore a vital component of integrated land use planning and development program that we are implementing throughout the country and in every county. Each unit of housing drives demand for different types of labor, professional services, and materials, bringing laborers, masons, bricklayers, artisans, electricians, and carpenters, as well as architects, engineers, and quantity surveyors, lawyers, real estate economists into the equation. Affordable housing is also a major opportunity for manufacturers, developers, and other industries. In other words, the economic boost from housing pillar of our bottom-up economic transformation agenda is significant and undeniably much needed. As we speak, affordable housing now directly accounts for 164,000 new jobs created over the past 1 year. Honorable members, today marks a significant milestone in our journey towards providing decent and affordable housing for all. After 2 years of hard work under the Affordable Housing Program, I am proud to announce, and you have seen it in the newspapers, the launch of the sale of the first 4,888 housing units, now in completion, across 21 social housing projects. These units, comprising studios, 1-bedroom, 2-bedroom, and 3-bedroom homes, are tailored to meet the needs of our people, offering 1,041 social housing units, 2,133 affordable housing units, and 1,714 affordable middle-class housing units in 24 counties. I invite every Kenyan above the age of 18 to join this historic journey towards home ownership. Guided by our principle of fairness, one ID, one house, every eligible Kenyan is encouraged to express interest, visit these developments, view the show houses, and engage with on-site staff who are already too willing to assist. The allocation process will be transparent and equitable, ensuring that every qualified applicant has an equal opportunity to own a home. Honorable members, as part of the government's endeavor to build a nation grounded in intergenerational equity, opportunities, and empowerment for all Kenyans, we have made significant strides in implementing another key pillar of our manifesto.